So, hi everyone, welcome. Today we're hearing from Dr. Oshinsky. So David Oshinsky is professor of medicine and the director of the Division of Medical Humanities at the NYU Grossman School of Medicine, where he focuses on 20th century US political and cultural history. As a member of NYU's Vaccine Ethics Project, he researches and develops strategies to counter the growth of vaccine hesitancy in the United States. Dr. Oshinsky is also a distinguished writer who has won the Pulitzer Prize for History with his book Polio, An American Story. Some of his many other publications include Bellevue, 3 Centuries of Medicine, and Mayhem at America's Most Storied Hospital, and Worse Than Slavery, Parchman Farm and the Ordeal of Jim Crow. Dr. Oshinsky received his BA from Cornell University and his PhD from Brandeis University. As we go through, if you have any questions, if you can just please unmute yourself to ask the question, and we'll also have time for additional questions at the end. But now I turn it over to you. Welcome, Dr. Oshinsky.
Thank you, and thank you for having me, Sarah. I guess we can start with the first slide.
Yes.
Right there, stop right there. And the question you might ask is, why does it say popular medical knowledge in the internet era? And I put this up personally because 5 years ago, we held this very large conclave at NYU at the hospital on vaccine hesitancy and the anti-vaccine movement. And there was so much blowback from the anti-vaccine forces that we basically had to change the title, because if we had anything relating to anti-vaccines, we would have had a mob scene. And if you can go to slide 2, you will see why. Okay, that was very early on the morning of the day we were holding our conference. And a big anti-vax bus had appeared from Texas. You can see it there. Langone Hospital is on the other side. And by the time we started, there were hundreds of protesters lining the street on the other side. And one of the reasons was that among the speakers were Dr. Paul Offit, and you might know Dr. Offit. He's very, very deeply involved in Operation Warp Speed. He is the developer of the rotavirus vaccine, very, very pro-vaccine. And also Dr. Richard Pan. I don't know if that name rings a bell for some of you, but he is a legislator in your state, in Sacramento. And Dr. Pan, who is, besides the legislator, is also a pediatrician. And he was the one who put forth legislation in California to do away with religious exemptions and philosophical exemptions. In other words, the only way you could send your kid to school, send your kid to daycare, send your kid even to a private school in the state of California was by showing that you had the child had been vaccinated for all the major illnesses. And there was enormous criticism and all kinds of violent threats against Dr. Pan. So when we got him here, and he actually came with a little bit of security, when we got him here and we had Dr. Offit here and others, we realized that having too many of these people in the audience would have turned this into a freak show. And I'll show you that we have a little bit of stuff I think in my latest slide, which will show you what happens during a demonstration in New Jersey inside the state legislature. And you will see it can get pretty angry and pretty violent. Some of you read the newspapers this morning, I don't know, the New York Times. You may have seen that RFK Jr. was taken off Instagram. He has 800,000 followers on Instagram, but the belief was that his anti-vaccine material is so volatile and so anti-factual and anti-scientific and misleading that he has now been taken off Instagram, and that's sort of an interesting point. And what some of you also may know is that during the awful riots at the Capitol on January 6th, a number of prominent anti-vaxxers were there, and a few were arrested. So that has become, I think, a really important issue that the hardline anti-vaxxers have now begun to kind of identify with and associate with the more radical elements of what we would consider to be sort of the right-wingers who assaulted the Capitol. Sarah, can we go to number 3? Now, before we start, I just want to tell you, this is during the 2016, one of the Republican debates. And during this debate, I guess, there was a mob scene of candidates, about 12 of them, but 3 of them were Dr. Ben Carson and Dr. Rand Paul and Donald Trump. And when you see this debate, Jake Tapper asks them a question about vaccination, and you will get sort of a wide variety of responses that will tell you, I think, very clearly what the various elements are in discussions of vaccine. And you'll see that there are sort of there's anti-vax sentiment, there's vaccine hesitancy, and those things are basically different, as we'll discuss later. But if you want to start now, you will see what I'm talking about.
Was blamed for a measles outbreak here in California. Dr. Carson, Donald Trump has publicly and repeatedly linked vaccines, childhood vaccines, to autism, which, as you know, the medical community adamantly disputes. You're a pediatric neurosurgeon. Should Mr. Trump stop saying this?
Well, let me put it this way. There have been numerous studies, and they have not demonstrated that there's any correlation between vaccinations and autism. This was something that was spread widely 15 or 20 years ago, and it has not been adequately revealed to the public what's actually going on. Vaccines are very important, certain ones, the ones that would prevent death or crippling. There are others, a multitude of vaccines, which probably don't fit in that category, and there should be some discretion in those cases. But, a lot of this is pushed by big government. And I think that's one of the things that people so vehemently want to get rid of big government. We have 4.1 million federal employees, 650 federal agencies and departments. That's why they have to take so much of our taxes.
Should he stop saying it? Should he stop saying the vaccines cause autism?
Well, I've just explained it to him. He can read about it if he wants to. I think he's an intelligent man and will make the correct decision after getting the real facts.
Mr. Trump, as president,
I'd like to respond.
Going right to you.
I'd like to
Mr.
respond.
Trump, as president, you would be in charge of the Centers for Disease Control and the National Institutes of Health, both of which say you are wrong. How would you handle this as president?
Autism has become an epidemic. 25 years ago, 35 years ago, you look at the statistics, not even close. It has gotten totally out of control. I am totally in favor of vaccines, but I want smaller doses over a longer period of time. Because you take a baby in, and I've seen it, and I had my children taken care of over a long period of time, over a 2 or 3 year period of time, same exact amount. But you take this little beautiful baby and you pump, it looks just like it's meant for a horse, not for a child. And we've had so many instances, people that worked for me just the other day, 2 years old, 2.5 years old, a beautiful child, went to have the vaccine and came back and a week later got a tremendous fever, got very, very sick, now is autistic. I only say I'm in favor of vaccines. Do them over a longer period of time, same amount,
Thank you.
Just in little sections.
Dr. Carson.
And I think you're going to see a big impact on autism.
Dr. Carson, you just heard his medical take.
He's an okay doctor. Okay. But the fact of the matter is, We have extremely well-documented proof that there's no autism associated with vaccinations. But it is true that we are probably giving way too many in too short a period of time. And a lot of pediatricians now recognize that, and I think are cutting down on the number and the proximity in which those are done.
And
I
that's
think
all
that's
I'm
appropriate.
saying, Jake. That's
Dr.
all
Paul,
I'm saying.
Dr. Paul, I'd like to bring you in.
A second opinion. One of the greatest medical discoveries of all time were the vaccines, particularly for smallpox. And if you want to read a story, it's called The Speckled Monster. It's an amazing story. It was all done voluntarily, but people came in by the droves. George Washington wouldn't let his wife visit until she got vaccinated. So I'm all for vaccines, but I'm also for freedom. I'm also a little concerned about how they're bunched up. My kids had all of their vaccines, and even if the science doesn't say bunching them up's a problem, I ought to have the right to spread my vaccines out a little bit at the very least.
All right, thank you.
So what you see here, and yeah, you can actually put that up. This was so controversial that the next day, the American Academy of Pediatrics said we would like to correct false statements made during the Republican presidential debate. And they debunked claims about autism. And they also said there is no alternative immunization schedule. Delaying vaccines only leaves the child at risk of disease for a longer period of time. It does not make vaccinating safer. And I thought that was interesting because when you see these three candidates, you kind of get a snapshot of what the anti-vaccine movement and anti-vaccine resistance is all about. One is Trump saying they're unsafe. One is Ben Carson saying there is no evidence of that. There is no link between autism and vaccines. But he mentions at one point there are too many vaccines being given, not just spacing out vaccines. And he seems to differentiate between those he thinks of diseases that are very dangerous and diseases that are not. And what he would do clearly is to put a disease like measles into the non-dangerous category. And we know from the Disney World outbreak and the Disneyland outbreak in California and what Richard Pan did, that there were real pockets of outbreaks of measles, and measles can send children to the hospital. When I was growing up and there was no measles vaccine, about 50,000 kids a year would be hospitalized by measles, and a number of thousand would die. This was a relatively serious disease, and it's very interesting to see Ben Carson sort of not only talking about spacing out vaccines, but in other words, there are too many, that some of these vaccines are unnecessary. And then you go to Rand Paul, and this is probably the most recent argument, and that is the Libertarian Argument. And by that, I mean it's parental decision. It's not up to the government to tell me what I should do in terms of my children. I basically am the primary decider in those cases. And you have sort of laid out for you what the major anti-vax arguments are and what pediatricians in particular are pushing back against. The one other thing I would say is that sadly, pediatricians in larger numbers have begun to space out vaccines for their young patients. And the reason they're doing it is the fear of losing these children altogether. In other words, for other medical issues. And you do have, as some of you may know, in New York City, for example, there are pediatricians who will not allow unvaccinated children in their office. And they actually have, they'll put out a notice saying, here are pediatricians in Manhattan who will treat your child. We think it's too dangerous to other children coming into the office to have an unvaccinated child there. The question, of course, is it's easy to do this in Manhattan, but it might be harder to do it in the middle of Nebraska, where there may be one pediatrician for 200 miles. So it's really become a major issue within pediatrics about what to do with parents who, after the quote unquote conversation, still simply decide they will not have their children vaccinated. Okay, next slide. This is an interesting slide. After, I think Senator Paul mentioned Edward Jenner, and I'm sure many of you know who he is. He was the developer of the smallpox vaccine in 1796 in England. And really, you began to have sort of the first major criticism of vaccination. It was seen by many as a lifesaver. On the other hand, what this cartoon shows is that people who are being vaccinated with Jenner's, it's really a cowpox vaccine, are taking on the characteristics of the animal itself. And that was widely believed. You also had people like Thomas Malthus, who believed that diseases, in fact, culled the population, and it was very important that diseases stay within society so they could keep the population in check. And you had all kinds of ministers as well who were talking about the fact that it was not God's will to have animal products put into a human body, that the human body was pure, it was made by God, and anything that changed this was against God's will. So all of these things sort of came together almost immediately to begin a kind of anti-vaccine movement from the very, very beginning in the 1800s in England. Okay, next slide. And I'm going to go very quickly, and then we'll obviously get to COVID. This is the Raggedy Ann doll, probably the most widely used doll in American history. I think it probably has greater sales than anything certainly up to the 1950s or 60s. It was very popular when I was a kid. And the backstory behind it, which has a lot of urban legend to it, is that the Raggedy Ann doll was made by, he's actually a songwriter early in the 20th century. And he made the doll completely flaccid, arms and legs flapping, because against his knowledge, his child in the early 20th century in New York City had been vaccinated against smallpox. And the shot had led to this condition and eventually the child dying. Now, there's a lot of controversy as to whether this is actually true, but the more important point is that it was taken on by the vaccinees, but by the anti-vaccine forces as a kind of symbol of what vaccination could do, and is still used by the anti-vaccine movement today. Okay, next slide, please. All right, this is a Supreme Court case, Jacobson versus Massachusetts. It's probably the only US Supreme Court case that has dealt directly with vaccination. I'll just say very, very briefly that this was the era that historians call the progressive era. In the late 19th, early 20th century, it was sort of a reaction against industrialization and immigration and the like. But what progressive states were trying to do, the legislatures, was to pass child labor legislation. In other words, they wanted to abolish child labor. They wanted to have maximum hours for people working in factories. It was also the era of Typhoid Mary. Some of you may know the case. She was a cook in New York City, an Irish immigrant, a single woman who was caught cooking in a rich family's house. Everyone had come down with typhoid fever. Epidemiologically, it led to Typhoid Mary. She was arrested and she was warned about it and let go with a promise that she would never cook again for other people. She was found 4 years later cooking under an assumed name in a hospital where typhoid fever had broken out and a number of people had died. What made it interesting about Mary Mallon is she is, as far as we know, the first silent or inapparent carrier, something that happens quite frequently now with COVID and also with polio and some other diseases. So she was perfectly healthy, but it was clear that she was giving off this bacillus and it was getting into the food of the people she was cooking for. Excuse me. As some of you may know, Mary Mallon's punishment was that she was put on an island in the East River, North Brother Island, and she remained there for 3 decades until her death. It was quite an extreme sentence. At the very time of Typhoid Mary, a case arose in Cambridge, Massachusetts. There had been a series of smallpox outbreaks in the state early in the 20th century, and the state and various municipalities like Cambridge had said that everyone must be vaccinated against smallpox. And if you weren't vaccinated, you had to pay a $5 fine, which was a significant amount in those days. Jacobson is a minister living in Cambridge, Massachusetts. He says, I am not going to get vaccinated. I'm not going to get my child vaccinated. It is my right to determine that. I think vaccines are dangerous, and I'm sorry, I will not be vaccinated. He is fined $5. He takes the fine to court. It goes all the way up to the Supreme Court. And this is a very conservative Supreme Court, but an extremely important 7-2 ruling. Its main argument and conclusion is that the Constitution of the United States does not import an absolute right in each person to be at all times and in all circumstances wholly free from restraint. There are manifold restraints to which every person is necessarily subject for the common good. So what the Supreme Court was really saying is that in medical emergencies, the state could take on additional power and demand your vaccination. Now, what I will say in the United States is there only been one instance in history, and we can talk about that during Q&A if you'd like, but there's only been one instance where we have forcibly vaccinated children, and that was in Philadelphia late in the 20th century. Generally, what we do is to put a penalty on not vaccinating. In other words, have a vaccine mandate, which in your state of California says that any child who is not vaccinated against, and they list the various vaccines, cannot attend a public school, cannot attend a daycare center, cannot go to a private school. In other words, there is a punishment attached to this. And that is the way we have generally done it. And one of the things we probably will be talking about in 6 months is whether there'll be a vaccine mandate for employers, whether an employer will say, you will basically lose your job if you do not get vaccinated against COVID in a specific period of time. We haven't come to that yet because the vaccines that are on the market, the Moderna and the Pfizer, are under EUA, which is emergency use authorization. So they haven't been fully approved by the FDA. And because of that, we cannot talk about vaccine mandates at this time. But I think at some point we probably will. Okay, Sarah, next slide. The next slide is polio. I was one of these little guys. I got my polio shot. That's Jonas Salk at the bottom and Albert Sabin at the top. Polio was this incredibly insidious childhood disease that caused paralysis and sometimes death. And there was no prevention, there was no cure. Parents, and it was particularly, we may be able to talk about this later, it was a disease largely of the 20th century and largely of the West, the United States, Canada, Western Europe, and the like. But 50,000 kids a year would come down with polio, and through an enormous private policy that was run by the March of Dimes. The government played virtually no role in this. The March of Dimes raised the money. They put together a virology committee. They went for the people who could basically do the best job and produce the vaccines most quickly. Salk produced an inactivated, injected vaccine. Sabin was an oral polio virus with live modified virus, weakened virus, obviously. In 1954, in the largest public health part in this enormous polio vaccine experiment, and half the kids were given the 3 shots of the Salk inactivated polio vaccine, and half the kids were given a lookalike placebo. It was double blind. No one knew who was getting what, neither the caregiver nor the person getting the vaccine. It took a full year, and word came down that this vaccine was safe and potent and effective, and America literally went into a day of celebration. Jonas Salk was invited to the White House, and for the first time in anyone's memory, Dwight Eisenhower, then President Eisenhower, broke down in tears as he thanked Salk for saving the children of the world. It was really sort of the high point for science. It kind of reached a level that in medical schools throughout the country, medical students were being told in textbooks and journal articles not to go into infectious disease. With the vaccines rolling out and antibiotics like penicillin and streptomycin, infectious disease was going to become a thing of the past. Go into chronic diseases, go into heart disease, cancer, diabetes, and the like. And we realized how incredibly arrogant that was. You just look forward a little bit and you see Marburg, Legionnaire's disease, HIV/AIDS, Ebola, Zika, and now COVID. But that really was what medical students were being taught at that time. The one thing I want to go into very briefly is that the worst vaccine accident in our history occurred right after the polio vaccine was authorized by what was then an early version of the FDA. Once the vaccine was seen as effective, every parent in America wanted it for his or her child. They just couldn't get it out fast enough. So what the government did was to give Salk's kind of his formula to 5 vaccine makers, 5 pharmaceutical houses, and they all went ahead and made the vaccine. There was very, very little oversight, unlike Salk's vaccine, which had extremely close oversight. And to make a long story short, one of the vaccine makers from Berkeley, California, Cutter Industries, produced a polio vaccine that had a lot of virulent live polio virus in it. And before that was stopped, before an epidemiological team came out and figured out what was going on, about 70,000 kids experienced extreme muscle weakness. Several hundred were permanently paralyzed and 10 died. Once they found out what it was, basically people lined up and started having their kids vaccinated against. And it was really a sense of risk versus reward. And what we know today is that vaccines are tested much more stringently than virtually any other biologic. Unlike anything else, they're given to healthy people as a preventative, mainly to children. And we have animal testing, phase 1 human, phase 2 human, phase 3 human, and then it has to go through an FDA approval process. So when vaccines hit the market, they are really extremely safe and hopefully efficacious. And one of the things I think people don't know is that from soup to nuts, when you start a vaccine to when that vaccine hits the market, it's usually a 10 to 15 year process, and only 6% of the vaccines that start at one end actually make it to the public. So it really is, in some ways, an extremely strict and safe process. Nothing is perfect, as we know, but vaccines are about as close as you are going to get. Okay, let's move on. I don't know how many of you have heard of Andrew Wakefield. Probably some of you have. I would say that if you are looking for how the anti-vaccine movement really springs up, there was virtually none of it, say during the polio years and with early measles vaccines, mumps vaccines, rubella vaccines, nothing. Parents basically were in a risk versus reward situation, and they saw the risk. They saw polio, they saw measles. The problem today is that vaccines work so well that they hide the evidence of what they have prevented. An anti-vaccine movement begins to spin off in the 60s and 70s, but it's small, and it mainly comes from people in my generation, kind of 60 food faddists, people who believe in holistic medicine. It's all fine, but they also sort of take it into, I see a question here. Yes, when asked who owned the polio vaccine, Jonas Salk said, it's for the world. Who can patent the sun? It was this incredibly noble gesture on his part. But if you read my book on polio, Salk and the University of Pittsburgh actually did try to patent the vaccine. The problem was that there were so many building blocks that went into this vaccine. You know, he stood on the shoulders of so many other scientists and laboratories that it would have been impossible for him to basically get the patent on his own. But I like to think of Jonas Salk as a noble person, so I will partly stand by that. The notion that what can you patent the sun? In other words, this is a vaccine for the world, and that is why I made it. And it is a very noble sentiment. So in the case of Andrew Wakefield, I just want to check the time, make sure that we have some time for questions. Andrew Wakefield was a British virologist, and he published a paper in Lancet. The Lancet, you know, is an enormously prestigious medical journal in England, in which he claimed that the MMR vaccine basically caused autism. It's hard for me to explain. There was a kind of what he believed there was a leakage in the vaccine, and it got into the digestive tract and went up there to the brain, and it did cause all kinds of learning issues, and very possibly was linked to autism. It was an extraordinary article in that there were only 12 subjects. They weren't chosen randomly. Indeed, most of them were kids who had come to one of his son's birthday parties, and he had actually vaccinated them right there. And he basically lied as well about the science of the vaccine. The problem was that really for the first time, the anti-vaccine movement now had a major scientist publishing in an extremely influential journal claiming that vaccines and autism were linked. It took a process of about 12 years and a lot of investigation, but eventually virtually all of the co-signers, the people who were along with Wakefield as part of this article, left. And the British Medical Association said that the entire process of exploration had been fraudulent, and the article was retracted, and Wakefield lost his medical license. Wakefield then came to the United States and without a medical license became kind of an anti-vaccine, almost like a Christ-like figure. And the more he was attacked by the traditional medical community, the more saintly he became to his followers, who believed that the only reason they were attacking him is that there was a conspiracy between the deep state, big pharma, and the AMA and the American Pediatric Association, not only to poison children, but to make money while they were doing it. And Wakefield now lives in Austin, Texas. I lived there for a while, and has enormous influence in the anti-vax movement. He just did a documentary. He speaks all over the country. There is evidence that he went to the Somali community in 2010 in Minneapolis and talked to them about the evils of vaccination. And suddenly there were measles outbreaks erupting in this community as vaccine use went down. Wakefield, of course, took no responsibility for this, but in some ways is sort of for these people, is the face of honest medicine in terms of vaccination. Someone had put up a chat. I guess we can talk about it a bit. Next slide, please. The Donald Trump one. Yes, there we go. Okay, here is a photograph of Donald Trump and Andrew Wakefield at one of Trump's 2016 inauguration balls. In other words, what Trump did in 2016 was to connect himself to the anti-vaccine movement, because what he realized was that these were single issue voters, cared about nothing else. They're sort of like a mini National Rifle Association. And having their votes was basically adding to his total. And there seemed to be very little issue with it. He didn't believe it was going to hurt him with other people. And therefore, he really sort of took Wakefield on. Now, what is interesting is that as soon as Trump was elected, he kind of moved away from Wakefield. But early on, you may remember, before he took office, he invited Robert F. Kennedy Jr. to come to Trump Tower. And what Trump did was, according to Kennedy and one or two others in the room, he told Kennedy that he wanted Kennedy, who's a very strong anti-vaxxer, to chair a federal commission on vaccine safety. And people really began to shudder. And then suddenly, Trump just dropped the idea to the point where RFK Jr. has now become a very strong critic of Trump, saying that Trump did not follow through. The other thing I will say about Trump is that, as you saw in that 2016 little video we showed you, was that he was also talking about spacing out of vaccines. And that became his new mantra. Well, and he kind of moved away from autism. He took his influenza shots as the White House doctor recommended. He said, I'm not sure why I'm taking them, but I've been told to, and I will. And what is interesting is, during the great measles outbreak in California that started in Disneyland, Trump actually went on national TV and urged people to vaccinate their children against measles. So what you see with Trump is that if he had ever felt strongly about vaccination and autism, he sort of gave that up politically. And as we'll see, once COVID comes about, he sees his reelection in 2020 basically surrounding and based upon a vaccine that could come out before Election Day. What I want to do, Sarah, is just to show you one quick clip, and then we can talk a bit about what is going on with COVID. Let me just preface this. It's a clip in the New Jersey State Legislature. They are convening a hearing about vaccine mandates, about whether to do away with religious and philosophical mandates and only have medical exemptions. And here is the anti-vaccine crowd in that room as the hearing is about to start. Okay, I think we've seen enough. I think you get the idea, and you also get the idea that this is one of the reasons why we were a little nervous about opening up our vaccine conclave to the public at large. Let me talk a little bit about COVID. I think there is good news in terms of anti-vax resistance to COVID and vaccine hesitancy about COVID, and there is not so good news. What is the good news about COVID in terms of the percentage of people who say they will take the vaccine? The good news, according to the Kaiser Foundation, is that the numbers of people in polls around the country again and again show that the number of people who were reluctant to take the vaccine is falling, and the number of people who say they will take it when their number comes up is rising. It's gone up from 50% to 63%, and now it is over 70%. And the question you want to ask yourself is, why is this happening? And I think there really are two reasons. One, we have seen that it's, in the case of Pfizer, Moderna, it appears to be very safe. You know that if there are any vaccine issues, health issues, 99% of them will arise within weeks of getting the vaccine, and we haven't really seen any of that. So the vaccine is effective and it's safe, and that has helped enormously. There's always been, for the second reason, there's always been a sense, I think, among virologists, pediatricians, and the like, that if there were a major epidemic or a deadly pandemic, you would see a lot of this anti-vaccine sentiment begin to disappear. In other words, people are now looking at risk versus reward very differently. This isn't like a polio shot where we haven't had a case of polio in the United States in 30 years. And you have to explain to people, yes, we have herd immunity here, but if we stop vaccinating, the numbers are going to go down, a case is going to arrive from somewhere else in the world, and polio will start up again. It's a much harder argument to make. You look at something like COVID-19, and what you see is that people actually are changing the risk versus reward dynamic. They're understanding that the risk is quite great, at least a majority of people are, and they're understanding that it's better to be vaccinated than not. What makes Robert Kennedy Jr. so different is he flips this and says it's healthier not to be vaccinated than actually to get COVID-19. And that is something that we really have to fight. The final thing I will say, which I think is worth discussion, is that when you look at the groups that are still lagging behind, in other words, which groups are well below 70%, there is a political dynamic. Republicans are much less likely, at least in polls, to say they will get the vaccine than Democrats will. Not surprising, but it's interesting to see the numbers, the span is quite great. Age makes a big difference. The older you are, the more likely you are to want to get this vaccine. We are more vulnerable to a serious case of the disease, but it's also likely that someone my age has seen polio. We've seen measles. We know what these diseases can do, and therefore we are much more amenable to taking these vaccines. There's also a rural-urban split. More people living in urban areas say that they are more likely to get the vaccine. And you have to factor out issues like this, or at least consider issues like age and political association as well. And the other issue is that African Americans are much more hesitant about getting this disease than Hispanics, Caucasians, Asian Americans, and the like. And that is disturbing. And we can talk about the reasons for this, but many of them are in a high-risk group, and there is more vaccine reluctance among this particular group, particularly among African American men. And there are good historical reasons for understanding why this is essentially the case. I notice I'm at 3:50, Sarah, so let me open it up for questions. And I'll be willing, if anyone wants, I'll be willing to stay more than 1 o'clock for you guys. Thank you. Any questions? Stephanie? You'll have to unmic yourself.
Hi, that was a really great talk.
Thank you.
Yeah, I was wondering if you could go into more detail about why African Americans were more hesitant to take the vaccine, and if there's like any efforts to increase
yes.
the willingness of the population. Yeah.
Sure, it's a very good question. I think one of the reasons is that there was a very famous study done in 2002, and what it showed is that African Americans, much more than any other group, felt that they were more likely to be used in medical experiments without their knowledge than any other group. And this has a long history. It can go back to the Tuskegee experiment, right? It can go back well into history through slavery and coming right up to the present. And that, I think, has caused a kind of reluctance that they are, quote unquote, guinea pigs when it comes to this particular issue. It's also true, I think, that at this point, and I've seen a lot of people and done a lot of studies on this, that we have to bring the vaccines into these communities, and we have to have the vaccines given by people who are trusted in that community, whether they be nurses, physicians, people who have sort of gained the respect of the community. Now, out in California, for example, I noticed that, like in New York City, you're opening up stadiums, Dodger Stadium and the like, to have these mass vaccine places. But what that means is, I think it's a fine idea, but what it means is you have to have an automobile, right? You have to be able to take X numbers of hours of work to go do this. You have to bring all kinds of identification. So I think it makes it much harder for people living in minority communities to have access to these vaccines if they want it. What they've also shown is that, they did a list of who people trust the most in terms of, if someone said, get vaccinated, whom would you trust? Your doctor or primary healthcare provider is number one. People you know in the community who have any sort of background are number two. Anthony Fauci is number three. Biden is just below that. Pharmaceutical companies are at about 40%, and the lowest is Donald Trump, who's at 34%. And I thought that was interesting in a way, because that 34% is probably, people who are very strongly anti-vaccine and are somehow strong enough in their beliefs that even though the president is pushing this, a person they strongly voted for, their libertarian streak is such that they are keeping their distance. So what I would say to you is make these vaccines community-based, bring them in, advertise, make sure that local physicians, nurses, healthcare workers are there to do the job. And I think numbers will move up significantly. Kathleen?
I have a question about another group that I've seen some articles around that have a particularly low rate of saying they'll get the vaccine. It's actually healthcare workers.
Yes.
And I happen to know personally a couple who say they don't want to get it yet. So could you talk about the dynamics there?
We can. There was a really interesting piece in the New England Journal not that long ago, in which Yale University asked its healthcare workers, those at Yale University Hospital, how many of you will be vaccinated? How many of you want to be vaccinated? 85% of them said yes. But at this moment, only 50% of them have showed up for vaccinations. And I think that it's very, very hard to figure it out. But the people that I have talked to, healthcare workers, are kind of in the view, I want to see what's going to happen with other groups before I fully commit myself. And, you know, I wish that weren't the case, but it's happening a lot, and it's happening where I work as well. And the question, Kathleen, will be, at some point, go in the hospital I work at, you must get a flu shot if you work at NYU Langone. And if not, you're given 2 weeks of unpaid leave. And if you still don't want your flu shot, yeah, you can get a medical exemption, but we have a committee, and it's extremely rare that they will give this out. And what is really interesting is that this is not only for frontline workers, it's for faculty like me, it's for people working 10 blocks away in public relations. It's people working down on Wall Street who do our finances, because the belief is that we are a medical establishment. We are in this together, and we must set an example. So it'll be really interesting to see what happens with healthcare workers down the line. Is that influenza vaccine is now taken by more than 99% of the people working at NYU Langone. So I'm hoping this is a bump in the road. And we'll see. I don't know that. Doug, yeah. I can't hear you. Can you hear him?
No, we can't hear you. If you can put your question in the chat, we can make sure we see it.
Okay. Okay, anybody else in the meantime? Douglas, you back online? Kathleen, can you go into, I'm sorry, Sarah, can you go into the chat, see if there's anything I should be, Douglas says I'm in the chat. Okay, can you?
So the question was, if the Wakefield paper was, how did it make it through peer review?
That is the $64 question. I think the fact that it was co-authored by 11 other people, some of whom were quite reputable, helped dramatically. I think it was the fact that it was seen as extremely novel and sort of going against the grain. Wakefield had a relatively good reputation at this time. And it would take a while. I mean, people were a little concerned about the small nature of the trial and the fact that there were no control groups. But it was saying something that people thought was very important. And within a relatively short period of time, questions arose, but it took the Lancet 12 years and a major investigation by a British newspaper to basically blow the lid off it. It's really, Dougie, the only thing I can say is I'm as at sea as you are. How I could see, okay, publishing it, but the 12-year interval for a retraction to occur is mind-blowing, is the only way I can think about it. But if you guys look up Andrew Wakefield, after we get off today, he can go to St. Louis and draw a crowd of several thousand people. And it's like a cult. These people are fervent believers in the fact that Wakefield was put on the cross for telling the truth, for talking truth to power. It's amazing. There's a new biography of him that has just come out, but he's making a lot of money and has gotten into the holistic movement. I lived in Austin. I love Austin. It's a very touchy-feely city, and he fits right in with a part of that population. Yes. What are some of the ways we can help? Good question. The big problem, I think, with the current COVID was from the very beginning naming it Operation Warp Speed. I thought that was a nightmare name, and I'm not alone. It almost sort of seems to indicate that speed is more important than anything else, that we're going to get this out at a hellacious pace. And I think that caused problems. The quickest a vaccine had ever come out was the mumps vaccine. It took 4 years. This was a vaccine that they were promising within months. It was going to get emergency use authorization. And Trump is pushing these people, get it out, get it out. And he's pushing the FDA, he's pushing the CDC. And I think that, when you ask people, why are you not taking the vaccine? Safety was the #1 issue that was used. And the safety was directly linked to the speed with which this vaccine was being turned out. And I think that what happened here was that once it had 95% efficacy, certainly in the 2 mRNA vaccines, and since there appeared to be, I've had both shots. The second shot kind of flattened me for half a day. I won't deny it. There was a reaction. Reactions are good to vaccines. It means the immune system is really kicking in. But there have, with one instance, with the Oxford AstraZeneca vaccine, there has not been an unexplained, very serious reaction to any of these vaccines. That's what we have to publicize. And I think where you begin is with your primary care physician. And my one recommendation would be, I would love for Medicare and Medicaid to pay the doctor for that first conversation. In other words, to hold a half-hour conversation with vaccine-hesitant parents, telling them about the science of the vaccine, about the safety of the vaccine, about why it's needed and how it protects your child, and let it be paid for so that this doesn't have to be rushed through in a 15-minute segment. I think that would go a long way as a starter. Any other? I'll certainly take one more. There are, I think, 9 things in the chat. Anything else?
Yeah, I think that's it for today. I just want to say thank you so much for coming and talking with us. We really appreciate it.
It's my pleasure. I really had a good time. Thank you all for coming. And if any of you have a question that you would like answered, email me. I'm on the website at NYU Medical School, and I'll be happy to answer any emails that were any questions that you might have. And thank you to everybody. I really appreciate it. Sarah, thanks again.
Yeah, thank you so much.
Okay, my pleasure. Bye-bye, folks.
Bye.